Kia ora, welcome to Women Power. This week we're looking at the position of women in other countries and how the women of Aotearoa can support women overseas. Progress on gender equality is slow or stalled in New Zealand, but is even worse in some nations. In 20% of countries, women have no legal right to equality. We'll speak to Dr. ICARE Russell, who set up a charity to provide medical and dental care in Iraq. Her work has won such acclaim that she was invited to speak at the Auckland TEDx. She established and runs Revive a Smile, aimed at providing Hamilton's homeless and disadvantaged people with free dental care. When she was only 12, ICARE had the idea of assisting orphans in Iraq with medical and dental care. She set up the Iraqi Children's Aid and Repair Endeavour, a medical and dental charity for orphans. ICARE is not only the founder of the charity, but leads a team of over 150 volunteers who provide assistance. ICARE joins us now to talk more about her amazing work. Kia ora, ICARE, welcome to the program.
Kia ora, Katrina, thank you for having me.
Great to have you here. How old were you when you had the idea for ICARE charity?
Well, Katrina, for as long as I can remember, really, I've always wanted to do something to serve other people. With ICARE, it wasn't until my second year of dentistry in Otago we were asked to do an assignment to compare healthcare systems, and naturally I chose my country of birth, Iraq, and New Zealand, where I grew up. And when I was researching, I came across this video of a little orphan girl who had a tumour and desperately needed surgery but couldn't afford it. And it was sort of at that moment, when I was still a student at uni, that I felt something in the pit of my stomach and I knew I had to do something. So that's sort of when the idea of ICARE came about, yeah.
And how did you go about setting it up?
ICARE took a very long time to set up, but really it literally started with a bake sale at university.
Wow.
Yeah, and a cookbook that I put together with my mother and a few friends. And our goal was to sell the book and do a bake sale to raise funds for this little girl that I came across in my research. And it sort of took off from there. So in just under a year, we sold enough copies of the cookbook to raise the funds that this little girl needed to get her surgery. So I wasn't a doctor at the time, but I certainly helped to make a difference. And that's sort of the idea behind ICARE, is that you don't have to be a doctor, you don't have to be extraordinary to make a difference and help other people.
Everyone can do something.
Everyone, that's right. Yeah.
And what does ICARE actually do?
Yep, so ICARE stands for Iraqi Children's Aid and Repair Endeavour. It's the first New Zealand registered medical and dental charity for orphans and disadvantaged children in Iraq. And basically it provides medical aid and funding to help provide surgeries for children over there, yeah.
And how do you go about doing that? Do you provide the medical people, or you provide money, or both?
Yep, so the charity has several projects up and running. The Sponsor a Smile project is sponsoring surgeries for children, so that's providing them with the funding, and also if the surgeries are not available in the country, it means sending them to elsewhere to have the treatment done and then come back. So that's Sponsor a Smile. We also run a prevention program, so that's more about educating Iraqi women and children that are living in sort of rural and areas and villages about healthcare and about diseases and looking after themselves, that sort of thing. The third project we also run is the volunteer project. So ICARE Volunteer actually sends health professionals to Iraq to volunteer their skills, and I believe we're the only New Zealand charity that are sending Kiwi health professionals to that part of the world to volunteer. Yeah.
And how great is the need for health and dental care in Iraq?
The need is very great. So Iraq is a country that's been plagued by war for decades, and that's had a huge impact on its healthcare system. So things that we take for granted here, availability of medication, availability of the specialists that are needed to do the sort of treatments that are required, it's just not there in Iraq. It's slowly getting better, but certainly in most parts of the country, the need is very great, and so that's the whole idea about ICARE, is providing services where they are most needed. Yeah.
And have Kiwi dentists and medical people been quite willing to volunteer their services to help?
Initially, it was actually quite difficult because Iraq is not the safest country in the world, let's just say that, and it's very unstable in that sense. But with time, when we have set this up, people have been more willing, and certainly, I mean, earlier this year, we usually go December, January period, we did have a group of health professionals travel over there and volunteer their skills, and we work in hospitals and we in areas that are relatively safe compared to other parts of the country. Yeah.
How many people has ICARE helped since it's been going?
Yeah, so it's actually been quite incredible. The charity's only been running for about 3 years, so we got it up and running in 2010. And since that time, we've actually helped hundreds of Iraqi people. And I mean, the Recipes for Prevention program is actually one of our biggest programs that we run, and so just in the coming month of December, we're planning on helping 100 families receive health products and health education and that sort of thing. So it's hard to put a figure on it, but it is getting bigger with time.
And can you tell us some specific examples of people or families that you've helped?
Yeah, so a lot of the work we do is quite complex. So the cases that we're seeing in Iraq are things that are requiring either major surgery, maxillofacial trauma, so that's trauma to the face from things like bomb blasts, so things that we don't really see in New Zealand so much. And so an example of a case that we've been working on for a few years now is a little girl who had suffered from a trauma from an explosion, and she needed sort of a complete workup, so from facial reconstruction, and now we're sort of towards the end stages of her treatment, which is providing her with dental implants. So it draws on lots of different professionals from different areas of medicine and dentistry, and that's just one example of the complexity of the cases that we're helping and working on. And I mean, we can't wait to be able to show people, and the donors especially, how far she's come. So that's the thing that makes ICARE quite unique, is that every child that we help, we set up a smile file for them so that the people who are donating towards this child can see their progress with time and follow their story through, yeah.
And has ICARE expanded to other countries apart from New Zealand?
Yes, it has. At the moment, we've got 4 branches inside Iraq, so that's the areas where most of the work is actually being done with our teams over there. We've also got 2 branches in Australia now, so in Melbourne and Sydney. And in the early 2014, we are actually launching a branch in the UK and a branch in the USA. So it's a very sort of busy time for us getting all those up and running.
And what's the best way that people can help ICARE? Is it by donating money or?
Yep, so donations definitely go a long way in terms of helping to fund treatment, but there's so many other ways that people can help. So as I say, it's not just about health professionals contributing. We've had people from all walks of life coming up and saying, hey, how can I help? Just an example of that, we've recently launched 2 apps on the Apple Store, and an IT professional said, I want to contribute to your charity, what can I do? And so he set up the apps for us, and they allow people from all over the world to follow our story and donate and that sort of thing. Yeah.
Thanks very much, Asil.
You're very welcome. Thank you for having me.